Hey guys, I'm going to talk a little bit about injectables, some of the injectables that I use, why I use them, what we can use them for, what are some of the benefits, what are some of the minor risks involved, and then I'm going to teach you how to mix them and how to administer them. So the main one I use, or the one I use the most often, is Sermorelin. You've probably heard some of my other videos or seen some of my other videos that talk about Sermorelin. I always use Sermorelin in the blended form with GHRP6 and GHRP2. Sermorelin is a growth hormone booster. And so if you don't know what growth hormone is, let me tell you a little bit about that. Growth hormone is your youth hormone. It is secreted by your pituitary, and your pituitary releases this hormone based on how much the brain is telling it to release. And so as we age, basically when you're a little kid, your levels are extremely high because you're growing so much. And then by the time you're getting into your 20s, you've kind of settled out. And after 20, basically each decade, your growth hormone drops by a significant percentage. I believe the percentage is about 14%. And so by the time you're 80 or 90, you just don't have a lot of growth hormone. So what does growth hormone do? It's kind of the miracle hormone. It sounds amazing. If you look at all the benefits, it's everything good and really kind of nothing bad. If you're overdosing on growth hormone, if you have acromegaly or a growth hormone tumor, there are bad side effects from doing it too much. The main one is that your hands, ears, feet, and face grow too much, and they can get kind of unusual looking. We call that acromegaly. But in this sense, when we're boosting growth hormone and trying to get your body to release more hormone, there's no way you're going to get to acromegaly. There's something wrong if you've gotten to acromegaly, and there's also something wrong if you've gotten to the blood sugar stages of problems with growth hormone. So the weird part is at optimal levels, growth hormone helps blood sugar, but then at high levels, it messes with blood sugar. I'll save you the explanation. So what do we boost growth hormone for? We boost growth hormone for those benefits. Better sleep, better energy, better muscle growth, bone growth, tissue regeneration, healing injuries. So if you have a tendonitis or a tennis elbow or something like that, improving your growth hormone restores the ability of your body to heal those things. There's also growth hormones inside your brain. Dr. Perlmutter talks a lot about the brain-derived growth factors that are in your brain that stimulate new memory and concentration and focus and repair cells and all that. So growth hormones are everywhere. I use PRP and stem cells. You've probably seen something about that on my website to help regenerate cartilage loss, arthritis, tendonitis, bursitis, any of that. And basically what we're harnessing when we grab PRP, which is basically just a blood draw, we take blood, we spin it down, get rid of the actual blood, and we keep the platelets and the plasma. And what we're harnessing in the plasma is actually growth hormones. Now, the growth hormone we're referring to with this is the specific growth hormone. But when this growth hormone gets released, it actually goes throughout the body and stimulates other growth hormones to be released. There's a cascade of growth hormones with all kinds of acronyms and letters, and I don't pretend to remember them all. Luckily, I don't have to in a clinical setting. So back to Sermorelin. Sermorelin, GHRP6 and GHRP2 are all peptides that stimulate your own body to release more growth hormone. So our brain has several tiers of hormones. The master hormone for growth hormone is called growth hormone releasing hormone. That's a fancy way of saying that. This hormone releases more hormone. And what hormone is it? Growth hormone. So I'll say that again. GHRH, growth hormone releasing hormone, stimulates the release of growth hormone. Pretty simple. Sermorelin, GHRP6 and GHRP2 act like GHRH. So this is not growth hormone by itself. That's called HGH. You've probably heard of it. It's really expensive, and there's no regulatory mechanisms built if you're injecting HGH. If you're injecting HGH, human growth hormone, there's no regulation by the body. The more you inject, the more you get. The downsides is, other than that there's no regulation by your body, is that if you inject HGH, then your own human growth hormone production actually starts to decrease, and that kind of sucks because then you're somewhat addicted to it. So Sermorelin is the kind of opposite. It is a growth hormone releasing hormone, so it stimulates your pituitary to produce more growth hormone. It does that by two main mechanisms. The first one is it goes to those somatotrophs, the cells that release growth hormone, and tells the DNA to make more mRNA, make more protein, make more growth hormone, release more. And then the second thing it does is when that stimulus shows up, the cells, the somatotrophs themselves actually multiply and grow a few more cells. Now you've got limited amount of space in the pituitary, we call it the cella turcica. There's limited amount of space, so this is not going to stimulate a tumor growth. It's going to stimulate a natural production of more cells to make more growth hormone. So the other benefit to doing it this way is that when you create more cells and when you activate DNA, that activation lasts a while. If you start growth hormone and then you stop growth hormone, your levels go from high to flat. And then your body has to recover and make more. Whereas with Sermorelin, your body produces more and more and more and more as long as you're using this. And then there's a ceiling effect. You can inject as much as you want, but there's a ceiling effect. Your body can only produce X amount. So even if you try to overdose, you're still going to hit that ceiling. And then after you quit taking Sermorelin, then that level is going to slowly teeter back down to wherever your normal natural level is. There are some things you can do to boost growth hormone. I'm not a big believer in all of the things that claim, the supplements that claim they can boost growth hormone. I think L-glutamine and carnitine has some decent research behind it, and those two aren't harmful, so it's okay to try those. But the easiest and best way that I use is the injectable Sermorelin. So I'm going to teach you how to mix the Sermorelin. So I often give these to patients, and in the freeze-dried state, you can see here that it's a white powder in there. And as long as it's in this freeze-dried state, it's good for a long time because this is a vacuum sealed, so no bacteria can live in here, and there's no moisture whatsoever, so it's impossible for any bacteria, fungus, anything like that to really get in there and live. If anything does happen to get in there, it's in a vacuum and it's going to die, just like we can't survive in space. Bacteria can't survive in space either. So in this freeze-dried state, it pretty much stays good forever. Now, I'm probably not supposed to say that by the compounding lab. They say discard by a certain date. But in my opinion, the freeze-dried state stays pretty good. So with that being said, I'm going to teach you how to mix it. So the first things you need are the appropriate equipment. So number one, you need whatever peptide you're mixing. And the same way of mixing goes for Sermorelin as it does for HCG. The only thing that changes is how much water or air you're adding in there, and then how much you're injecting each time. So number one, you need the vial that you're mixing. Number two, you need water. Now this is important to watch the expiration date on because this is water, is not vacuum sealed. This can get contaminated. As long as it's clear, water's supposed to be clear. This is sterile water, so if it's clear, you're all good. Now caveat, if it's expired, just get more. That stuff's cheap. So that's number two on the list. Number three on the list is you're gonna need some sort of mixing needle. I usually give people the 3cc with this giant needle on it, and it just makes it easier to transfer air and liquid back and forth. And then of course you will need alcohol swabs. You can do the old-fashioned cotton balls with the alcohol bottle, but these things are dirt cheap. Just pick some up at your local pharmacy and they're way easier to use. So how do we mix it? Step one, we have our vial. We have our water. We're going to need to put some in certain ones. There's a heavy vacuum on the vial. So the first thing I like to tell people is that you want to neutralize some of the pressure in here. The reason being is because when you go to add the water, if you add the water too quickly and it bubbles during the insertion, bubbles destroy peptides. So pretty much the more bubbles you see in your vial when you're mixing, it's pretty much destroying peptides, and you've probably paid decent money for this and you don't want to destroy it. The other problem is with peptides, you don't know how much of it is active based on looking at it. Just because it's clear doesn't mean it's actually active. So what do I mean by that? An easy explanation is if you take a paper clip, that is what a protein or a peptide looks like in its natural form. A paper clip has a very specific form, and basically if you bend that paper clip or pull the wings out, then that paper clip actually isn't a paper clip anymore. It doesn't serve its function. However, it still has the same structure or the same loop, the same metal that it did before, but now it's not active. The same thing goes in with a peptide. A peptide has a 3D form, a 3D shape, and if you put too many bubbles in it, you disrupt that 3D shape, and while it still has all the parts of Sermorelin, if it's not in its correct 3D shape, it actually has no use, no purpose whatsoever in the body. It won't be toxic, it won't do anything bad, it just won't work. And the whole point of doing this is so it works. So step one, we neutralize the air. The first thing you want to do is you want to pop off that little cap, and it's a little tricky to get off. You just got to find a little spot, get your nail under there, and then it bends up like that, and then you just pop it off. that exposes the rubber top and that little center thing there. And whenever you're piercing it, you want to aim for that little circle in the middle. So anytime you pierce anything with a needle, you use an alcohol pad. So I've got my alcohol pad. You can't ever clean it too much. So just clean it every time so that you're safe. The last thing you want to do is infect this stuff and then infect yourself. That kind of stings. Not only are you not getting good product because the bacteria ate it, but then you're shooting bacteria into yourself, and that's generally frowned upon in the medical arena. So next, you get your needle. This is a giant needle. Don't worry, you won't be poking yourself with it. You're just using it to mix back and forth. So the first thing I like to tell people is this is about a 10 mil vial. You may not know that, but I'm telling you, this is about a 10 mil vial. And so there's 10 mils of air that is not in here because it's a vacuum. So the first thing I like to do is just to remove the pressure a little bit by putting 3 mils of air in there. So how do we put 3 mils of air in there? We simply take the needle and we draw it back to 3. Once you have 3, then you stick it in. Now I've already cleaned the top with alcohol, so make sure you do that. The next thing I want you to do is wrap your fingers around that plunger and hold it tight, because you're gonna feel, I want you to feel how much pressure is being pulled on this plunger after you insert it into the vial. So this is vacuum sealed, and I'm gonna hold the plunger right here with my hand, and I'm gonna insert the needle through the circle. And then I'm gonna feel how much pressure is being pulled. Now you can't tell, but I'm holding the needle pretty steady. Now there's not terribly too much pressure. See how I can kind of let go and the syringe slowly goes in by itself? So that tells you that there's still pressure in there. And if you're not sure, it's easy to tell. You just pull out a little air and then let go. And if it goes in, there's still negative pressure in there. Okay? You don't really ever want to put positive pressure in there. Like if you release and the plunger's going back, that means there's positive pressure in the vial. If you have positive pressure in the vial, when you pull the needle out, it's going to shoot product out of your vial, and that kind of defeats the purpose because you've paid good money for it. Now, this is fairly simple physics, but if you're not thinking about it, you can make mistakes. If you have the vial turned upside down when you pull the needle out and there's positive pressure, well, water is going to be at the, or a product, the liquid is going to be at the bottom, and it's going to spray liquid out. If you withdraw the needle while it's upright and there's air at the top, then if you happen to have positive pressure, then it's going to just spray air, maybe a little bit of product, but not that much. So if you're ever worried that you have positive pressure, just flip it upright and pull the needle out. But really, if you have positive pressure, all you have to do is pull back on the plunger while it's inside the vial, and that will neutralize the pressure. You always want a little bit of negative pressure inside the vial. So back to the beginning. I've inserted a little bit of air, 3 cc's of air, and this is a 10 mil vial. So there's still 7 mils of vacuum inside there, but I'm gonna be adding 6 mils of water. So then that leaves 1 mil of vacuum still left over. Does that make sense? 3 plus 6, 9 mils, and then 1 mil of vacuum left over. And I'll probably add a little bit more vacuum at the end. So, and maybe this will make more sense as you do it over time and as you see it. So next we're going to add the water. This is bacteriostatic water. It is sterile. You don't want to use non-sterile water. You don't want to use tap water. I think you understand why. You want to pop that little cap off. There you have it. The cap's off. There's your little rubber stopper. Now technically when you pop that top off the first time, it is sterile, so you wouldn't have to wipe it. But like I said, you can't over clean something, so give it a nice little wipe with an alcohol pad. Now make sure the alcohol pad is still moist, because alcohol does dry out and a dry pad does nothing. So now we want to put water inside the Sermorelin vial, but this is a 3 mil syringe and we need 6 mils of water inside the vial. So we're going to do 2 sets of 3 mils. So how do we do that? Let's pull it all the way back to 3 mils. Let's mark the spot. There it is, 3 mils. We've already cleaned the top of our water. Now you're going to insert the needle into the water. Pretty simple. And then you can inject the air so that you don't pull negative pressure. Once you create positive pressure in here, you see the plunger's already moving back, and basically if we gave it enough time, it would eventually get to 3 mLs. Now you want to make sure your needle is actually inside the water, because if you stick it in too far and you're in the air, well, you're just going to pull in air. And you don't want air. Can you see the air bubble I pulled in? You don't want air, so simply push that air back in, boop, and then pull it out a little bit and make sure the needle is inside the water. And then pull all the way down to the 3. There. I've got 3 mLs of water and no air bubbles in there. Now, it's not a problem if you have air bubbles in here, and it's not a problem if you have more than 3 mils in here. This isn't really a perfect science. The reason why we're doing 6 mLs is because we're trying to get this vial to last 30 days. And so if you mix less than 3 mil or less than 6 mils in here and you're injecting 20 units every day, it's just not going to last a full 30 days. You're not going to poison yourself. You're not going to damage yourself. It'll be a little higher concentration, but it just won't last long enough. So if you put 6 mLs, the injection is 20 units per day, and that will make 30 doses. And if you're doing it every day, that's 30 days. So if you want to put a little bit more, that's up to you, but this vial won't hold a ton of fluid. So now we've got our 3 mLs of water. I'm pretty darn close. What are we going to do? Now we're ready to mix it inside the Sermorelin. So we're going to wipe the top. Each time we go to pierce it, you're going to wipe the top. And then, once again, we don't want to destroy the Sermorelin. I'm going to say this multiple times. You don't want to destroy the peptide. So wrap your fingers around that plunger, hold it very tight, and insert the needle through the rubber stopper. And you want to kind of aim the needle upwards, and you want to watch the tip of the needle inside the vial, and you want to watch the water just slowly drip into the vial. You don't want it spraying, you don't want it splashing, you just want it slowly dripping. You may not be able to see it, but the needle is barely in there, and now I let go of the plunger, and there's not a lot of negative pressure, so I'm going to push on the plunger very gently, and water's slowly going to drip in there. You can see it drip, 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 and you want to take your sweet time letting this drip, 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 drip. You might be able to tell that powder, see how it's in there? It doesn't take much for that powder to evaporate. If you're thinking of it like sugar, it would take a lot of water for that to, I said evaporate, I'm sorry, liquefy. Once that water touches that freeze-dried state, it liquefies almost immediately. So we're just going to slowly drip this stuff. I don't see any bubbles, so that means I'm doing a good job. And just slowly push that water in there. Don't worry about mixing the powder yet. That will happen over time. Now I'm having to push on the plunger a little bit, which means I'm getting closer to a positive pressure, so that there may not have been 10 mils of full vacuum, and that's okay. We're going to drip all that fluid in there. No bubbles. As long as there's no bubbles, you're good. So now I'm done injecting all of my water. And see how I've let go of the plunger? See how it's backing up? That means that there's positive pressure in there. So I don't want positive pressure, so I'm going to create some negative pressure. First, I'm going to make sure I get all that water from my syringe into the vial. So I'm going to push it back in. And now there's no water, and my needle is in the air, not in the fluid. Once it's in the air, I'm going to pull back on that plunger to create some negative pressure, because remember, I'm going to add more fluid in there, so we want negative pressure. So I'm going to pull this plunger all the way back to 3 mLs, kind of max it out. Make some negative pressure, make sure there's no fluid inside of my syringe, and then I'm going to pop it out. Notice you didn't hear a psst. If you hear a psst, that means there was positive pressure. Let me see if I can show you positive pressure. So hopefully I won't waste any of my product. So I'm going to put some air in there. Don't do this. I'm just showing you how. Did you hear it? It sprayed a little. I'm going to do it one more time so you can hear it, and I won't be talking. So I'm going to put some air in there, and then I'm going to let go. And of course it didn't do it that time. Let me put a little bit more air. There. That little spray, it might have sprayed a little bit of product, but not much at all. So you don't want that, because that's going to spray your fluid. Now, if I had held it upside down, it would have sprayed all liquid and all product everywhere. So now that I did that, I'm actually going to pull some air out, because I don't want to spray it all over the place. So let me do that real quick. Okay, so now I've created my negative vacuum once again. So there's 3 mLs of water in here, which is not enough to last 30 days. If you injected 20 units a day, it would only last 15 days. Now, if you can already see, it's almost all dissolved already. There's a little bitty flake in there that you may not even be able to see on the camera, and we've only put 3 mLs. So this stuff dissolves really well. So we're going to put 3 more mLs, and my cat is unhappy. So I'm going to put 3 more mLs of water. So once again, we draw the syringe back to 3 mLs. There it is. And we're going to put 3 mLs of air in, and then we're going to pull out 3 mLs of water. Now, I've got a little air bubble in there, and I don't want any air bubbles because I want 3 mLs of solid water. So if there's any air, just inject it right back in. Sorry, a little high. Just inject it right back in and pull back. Make sure your needle's in the water, not in the air. And there you have it. There's a tiny little air bubble in there, so if you want to pull back just a little bit more than 3 mLs, not really a big deal. And if you're too high and you want to push the plunger, just waste some of the water, that's fine. Okay, so now I've got 3 more mLs of water. My alcohol pad's starting to dry out a little bit, so I'm going to go ahead and pop another one open. There you go. Let's wipe our Sermorelin. And now we're going to go back in. Now I don't have to hold the plunger too tightly because there's not much of a vacuum on there, but I'm going to hold it anyway because I don't want to destroy my product. So we're going to pierce the vial. There it is. And then, yeah, see, I let go of the plunger and not really a lot of pressure. So I'm going to push all this water in there. Drip, 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 drip. Now you want to take your time. If it takes you a minute or two to push this in there, then take your time as much as you want. I've done this a few times, so I can kind of guess how much pressure to put on there without making any bubbles. And I don't see any bubbles, so that means I'm doing excellent. So almost all done. And then remember, every time you're mixing, before you pull out the needle, you always want to make sure that you don't have positive pressure. So I let go of the plunger, and look at that, I do have positive pressure. So that means I need to pull back. So pull it back to 3 mLs, and it's not going back in, so that means I still have positive pressure. So let's remove some more air. Insert it in. Make sure it's not in the water. Pull back. Oh, see, I did pull a little bit of water, so I'm going to squirt that water back in there gently. And let's pull back some, pull back some positive pressure so that we create a negative pressure. And that should be enough. It's not quite pulling the plunger back in, but it doesn't necessarily need to. And there you have it. Now you've got a neutral / negative pressure, and you're ready to go. So now this is fully mixed. After a peptide is mixed, it must go in the fridge, and it must be free from light. So that means that once it's in the fridge, you got to make sure your fridge light turns off. But how do you know if it turns off? Every time you open it, the light's on, right? So that's a joke. But if you really are worried if your fridge light is on, you can put your phone in there, put the video on, and close the door, see if the light goes off. Anyway, so once it's mixed, you shouldn't see any flecks of powder or anything in there. Occasionally there will be a little fleck that doesn't want to dissolve in there, and if it doesn't, that's okay. You're not going to harm it. Yeah, not all the product perfectly dissolved, but the majority of it did. 99% of it did. If you see a little flake, that's just a tiny percentage of it. If you really want to get it, which you don't want to shake it because you're going to make bubbles. So what you do is you can just kind of gently roll it between your hands, back and forth, back and forth, back and forth. You can put it on a washing machine that's spinning. You just don't want to form bubbles, so you want something nice and gentle. You don't want to put it on a blender or anything. So you can roll it back and forth between your hands, or you can put it on the table and just kind of roll it back and forth gently. Remember, if you see any bubbles, you're doing too much. This is a peptide. You don't want to try to get that last little 1% and destroy the other 99% by doing it. So gently rolling back and forth. If you try to do this after you refrigerate it, it's nearly impossible to get that to dissolve just because it's cold and chemical reactions happen slower when it's cold. So it's already dissolved a little bit since I've been doing that. In the interest of time, I'll actually move forward. But if you want to get the rest of your flakes, then please, by all means, do it. So now I'm going to teach you how to inject this into your body. As far as Sermorelin goes, I always tell people to inject it as close to bedtime as possible. So the way I usually tell people to do that is if your fridge isn't right next to your bed, which is probably a bad idea for most people, what you can do is before you get into your bed, you can prepare your needle and set an alcohol pad and needle right next to the bed, ready to go. And as soon as you're ready to go to sleep, you just lean over, inject yourself, go to sleep, no big deal. The main side effect with injecting Sermorelin is the hunger, abdominal nausea, kind of abdominal pain. I hate to say abdominal pain because it's not really pain, it's just that kind of grumbling, hungry feeling in your belly. And then some people get a headache. So minimal side effects, and if you are having side effects, we can just dial down the dose a little bit and then it's not as bad. So I'm going to teach you how to inject a peptide into you. This same process goes for HCG, Sermorelin, whatever you might be injecting as far as sub-Q. This also works for B12 injections if you're doing those sub-Q, although not everyone uses the insulin needles for those. So how do we inject Sermorelin? I'm going to do 20 units because that's what I usually recommend to people. If you put 6 mils of water and you inject 20 units a night, then you will last 30 days or 30 doses. So step 1, I did this without telling you, wipe the top. Alcohol the top. Anytime you pierce anything, you wipe it with alcohol. So step 1, wipe the Sermorelin. Step 2, these insulin needles come with 2 orange caps to tell you what to remove. And so now you have your insulin needle. You should have 20 units. Insulin needles are pretty much all the same. So it doesn't matter if there's 50 units total, 100 units. you're aiming for 20 units on these. Now we can go higher, and you may need bigger syringes, but that's it. The first thing I do is kind of break the seal a little bit, just pull back on the plunger. It's a little sticky the first time you pull back, so pull it all the way back and then close it all the way, push it all the way in so that you're all the way at the 0. Now, wipe the top of the Sermorelin. We did that already, but it never hurts to do it again. I don't really tell people to inject air because you don't want to create positive pressure. You want to create negative pressure. So you take your Sermorelin vial. This needle is not that long, so you do have to invert the vial because you need the fluid at the bottom. Now you take your needle, you stick it through the vial, stick it through the rubber, and now it's inside the Sermorelin. And all you do is you pull back on the plunger. You want to pull it back very gently and very slowly. If you just whip this thing back all the way to 20 units and you see the fluid streaming in and it's making a spray like it's spraying inside because you pulled so much vacuum, you're making bubbles, you're destroying your peptide, and that's not what you want. If you're destroying your peptide, you're not doing anything. So slowly pull back as it's filling the syringe and get all the way to 20. Now, if there's a little air bubble, you've got two options. You can squirt it all back in and pull back, or you can just pull back 21 units to make up for that little air bubble. I don't encourage people to squirt it all back and pull it back in because peptides are sensitive. Each time you pull it through that tiny little needle, you destroy some of the peptide. So I would say if you've got a little air bubble, just dial back to 21 or 22, no big deal. And if you don't want to dial back, that's okay. It's just an air bubble. You'll just get 1 or 2 units less. So now I've got 20 units here, and we're going to use this to inject it inside of our, I'm going to use a mango. So that's how you do it with the Sermorelin. I'm actually going to squirt it back, and I'm going to use some water so I don't waste my Sermorelin. And I'm going to pull 20 units of water. I should have done that the first time so you wouldn't know. So I wipe the water, pierce it with the needle. This I don't have to worry about being destroyed, so I'm going to do it quickly. And there I am at 20. So my needle and fluid is at 20 units. Just pull back to 20 units. It's also 0.2 mLs, 20 units. And then the next step is we want to prepare our skin. So this will be a mango. But what you want to do is you want to take your alcohol. So where do you inject? You don't inject your mango. The best places to inject are around the belly button. You want to stay about 1 inch or 2 inches away from the belly button. The belly button just doesn't get great blood circulation, but it also doesn't get great nerve distribution. So that's why we like around the belly button. The main thing you want to look for when you're injecting this is you want this to be injected into fat tissue or adipose tissue. So you can inject it into a fatty part of your thigh, fatty part of your stomach, a fatty part of your arm. It doesn't really matter where it goes. It just has to be in a fatty place. So most people choose the belly. It's easy to access, easy to get to. So what you want to do is you want to wipe the skin with your alcohol pad, a nice fresh wet one. So I'm going to wet my mango skin with alcohol. The next step is you want to pinch the skin. You want to pinch it because pinching it makes you not feel the needle so much. So pinch the skin up, make it nice and taut and a little tinted, and then you take your needle and just real quick in. If you slowly go in, the pain you feel is the needle going through the skin. So make that as quick as possible. Just a quick dart. 1, 2, 3, boom, and you're in. Once you're in, you can keep squeezing if you want to, or you can let go, and then you just slowly inject your Sermorelin or your HCG into the fat tissue, and then this is important, let go of the pinch. If you're still pinching when you let go, you'll actually pinch some of the fluid out, and that defeats the purpose because that's what you want. That's the peptide you want to keep in there. So relax your pinch. Once you've relaxed your pinch, and let it sit for a second because you want that fluid to go in and kind of dissolve through the tissue before you remove the needle, otherwise it'll follow the needle out. So after the fluid's released and set, then you just quickly pull the needle out. No fluid should rise to the surface. If you see blood, that's okay, but if you see clear fluid come out, then you know that that was your Sermorelin because your fluid is not clear. Your fluid is going to have a little blood in it. So if there's fluid coming out, that means you've lost a little bit of water. So you can see my mango put out a little water, and that means that it didn't stay in the tissue, but mangoes aren't designed to receive water injections. So once that's done, you can look at the skin. If you have a blood spot, then you might want to just put your finger on it to hold some pressure, and then it'll stop. Normally, you shouldn't need a Band-Aid or anything from a insulin injection, but you're welcome to put a Band-Aid on afterwards. And then that's basically it. As far as what to do with the needles and sharps, you've got a couple options, at least here in Texas. The rules in Texas are a little relaxed. What most people do is you get either a 2-liter bottle, a Coke bottle, or a wine bottle, any kind of glass bottle, plastic bottle. It just needs to be some sort of container, and you drop the needles inside of there. Once you drop the needles inside of there, you do not recycle that plastic bottle or wine bottle. That now needs to go in the trash. But that is considered an adequate way to dispose of needles in Texas. If you want to make your container last longer, when you have these needles and syringes, you can throw the needle into the container and just throw the regular syringe into the trash. The insulin needles, you don't have a choice. The whole thing has to go inside the Coke bottle or wine bottle. You might want to make sure that you put this container somewhere where people can't see, otherwise they may think you're a drug addict or something when someone comes over to your house. If you can buy Sharps containers at the pharmacy, but if you buy a Sharps container, you can't really throw that in the trash. That needs to go to a proper disposal facility. So I usually encourage people just to do the plastic bottle, wine bottle. If you're out of state or outside of Texas and you're watching this video, make sure you look up your state's laws as far as what you can do with needles. But that's the basics on how to inject Sermorelin, how to inject HCG, or basically any peptide. If you're getting your peptide from someone else, or from some other manufacturer, the main thing to ask your doctor or whoever is prescribing it is how much water or solution or whatever are you mixing in it, and how much are you injecting every day. If you find those two things out, then you can use the same video, just change the volumes. And it's basic physics, so after you do it a few times, you'll understand it. Now that I've mixed this has to go in the fridge, in the dark, and you only take it out when you want to prepare your needle, and then you put it right back in. If it stays out, it doesn't necessarily mean it got infected, but once again, it's a peptide, and so if that peptide breaks down, then it's just not active. So the longer it stays out, the more likely the peptide got destroyed and won't be very useful. The good news about people that get side effects when they inject Sermorelin, like the hunger and the abdominal pain or aching and the nausea, is that you know the peptide's still active, at least some of it. So if you leave it out for a day and look at it and go, whoops, I left that out, and you inject that night and it still makes you nauseous or still makes you hungry or whatever, then you know your peptide's active. If the peptide is inactive, it just shouldn't cause those symptoms. Okay, so I hope this was helpful. I hope this explains some things, and hopefully this will help my patients mix their solutions and not destroy them inappropriately. So feel free to leave me any questions, comments, if anything I need to add to the video to make it more helpful.